Recording in progress. Right, so good morning. Yeah, we have a few more slides left for the lower limb muscles. And after that, I believe we finished pretty quick. And after that, we will revise the renal and the lower limb, what we have learned, so that just memorize and then just try to pick up a few more things stuck in our mind. And so, let's say today we are going to finish the, all the systems other than the nervous system. So usually I take about 6, 7, might be 8 lectures for the whole nervous system. So, which means like we are going to finish this anatomy before the end of November. So which is good. We got time to revise the whole class, the whole semester. So like starting from August. So once we finish the nervous system and the exam, we will try to revise the whole anatomy for the whole semester. So starting from August down to like nervous system. So I think that will be a good time. We have more fun. There are a lot of things you have forgotten. There are a lot of things you have understood. And, we have a discussion and we play the game. And I believe that will be a good time for everyone. So yes, we talk about the lower limb muscles. We talk about the gluteal muscle, which is buttocks muscle, the muscles of the thigh, muscles of the leg, and we need to talk about the muscles of the foot. So so a few little things I want you to remember. Gluteal foot, that's the name, important, because if you are in urgent care and if you make a referral to somebody, you need to know where the injury is. So if the stab wound is just around there, you have to say just below the gluteal foot. So that's the other guy from the opposite side on the phone can understand. And natal cleft, and this buttock muscle is made of gluteus maximus. So, and the natal cleft here in between two buttocks, intergluteal cleft. So that's, like a few little important terminologies which will be useful for you when you are communicating with another healthcare person. Let's say if you are a doctor and if you are going to speak to a surgeon for the wound, penetrating wound, hey, the wound is just below the gluteal foot, about 2 centimeters below the gluteal foot. So the guy from the opposite side will understand you. Of course, if we remove the skin, that is what we are going to see. This is the gluteus maximus, which is purely posteriorly. And therefore, if this gluteus maximus muscle contract, the hip will extend. The hip will extend. If you look at that gluteus medius muscle, which is more on the lateral side, and therefore, if this gluteus medius contract, then this leg will go outwards, outwards. So that is the action of the gluteus maximus and gluteus medius. Gluteus maximus will extend the hip, and gluteus medius will abduction of the hip. And don't forget where you need to do intramuscular injection in the buttock. So the safe side is outer quadrant. That's where you want to do the injection. In a lower quadrant, that's where you don't want to mess around, because there is a big sciatic nerve running, which is running at the back of the buttock and going along the thigh. So that's somebody's buttock. So let's remove everything. Hey, it's beautiful bed, but just remove everything, and that's what we have. That's what we have. That's you and me. Like, we have this ilium, the bone plate, and this is what we call iliac crest, anterior superior iliac spine, posterior superior iliac spine, anterior inferior iliac spine, and posterior inferior iliac spine. Is greater sciatic foramen, ischial tuberosity, ischial tuberosity, lesser trochanter, greater trochanter, and this is a little pointy bony portion, ischial spine. Okay, let's put all the muscle back. Let's take the skin off. No more skin. We can see the big muscle at the back of our buttock, which is gluteus maximus. Maximus, big, large in the gluteal region. The largest muscle of the gluteal region, gluteus maximus. And now I'm going to remove the gluteus maximus, and I have the gluteus medius. Yeah, so which is just partly covered with the gluteus maximus. Now I have the gluteus medius when I remove the gluteus maximus muscle. If I remove the gluteus medius muscle, there will be gluteus minimus muscle here. Wow, wow, wow. Okay, so gluteus minimus and gluteus maximus, they are more on the lateral aspect of the hip, and therefore their job is to abduct the hip and the femur. Right. So now when we see the gluteus maximus, just look around at the back of the hip and you can see a quadrangular muscle, which is quadratus, because it is in the femur, so quadratus femoris. And yes, gluteus maximus, medius, and minimus, the nerve supply is important. Medius and minimus are together supplied by the superior gluteal nerve, and maximus, although it is very much superficial, just underneath the skin, it is supplied by the inferior gluteal nerve. It is for the hip extension mainly. To some extent, it might help with the abduction, but medius and minimus, hey, it is only for hip abduction. So now we have removed the gluteus maximus, gluteus medius, and we can see the gluteus minimus muscle here. And then I want you to appreciate this little triangular muscle, which is pretty strong muscle here, becoming a thin and shining tendon, which is what we call piriformis. Piriformis come and attach to the tip of the greater trochanter. And in between piriformis and quadratus femoris, we have superior and inferior gemelli, and in the middle, obturator internus, because it is in the middle, internal. Superior and inferior gemelli, piriformis and quadratus femoris, gluteus minimus muscle. Oh, why this piriformis muscle is important? This is the piriformis muscle, and just underneath the piriformis, we have our sciatic nerve. So piriformis is the landmark for the sciatic nerve. So if you don't know where to find the sciatic nerve, you need to go to the back. You need to go to the back of the greater trochanter, which is somewhere here. You need to find the piriformis tendon and follow the piriformis tendon. There will be a big nerve structure which is coming underneath the piriformis. That will be the sciatic nerve. Wow, okay. So that's the sciatic nerve, which is really important for our lower limb, which is going to do a lot of function for us, and we can damage the sciatic nerve. That's the way it goes, just coming out from the sacrum. Its roots originate from the sacrum, and then it's just come underneath the piriformis, and it runs posteriorly in the back of the thigh and downwards. And finally, it will divide into two portions. One is what we call common peroneal or common fibular nerve, the same. And another one is tibial nerve here. Tibial nerve, it is going to divide, sciatic nerve is going to divide into tibial nerve and the common peroneal or common fibular nerve. So we need to know the anatomy of the sciatic nerve to some extent. But let's move on with the muscle here. We know the gluteus maximus, medius and minimus, quadratus femoris and piriformis. In between, we have obturator internus, superior and inferior gemelli. Right. So Origin and insertion, just for the sake of completeness, I have put it here. They are not that important. Of course, if you have time, if you understand the previous muscles, then I want you to look into that. These, but it will not be in the exam. So look at that again. So gluteus maximus, gluteus medius, and you can see the piriformis here, pointed, become a little shining tendon, go and attach to the tip of the back of the greater trochanter. And just underneath, we find the sciatic nerve here. We find the sciatic nerve here. Okay. So look at these little circular structures. So one here, we can see the yellow nerve and the blood vessel and vein. And here we can see the yellow, which is a nerve, and the blue and red, which is artery and vein. What are they? They are the superior and inferior gluteal nerve. So SG, superior gluteal nerve, which is coming above the piriformis, and IG, inferior gluteal nerve, which is coming below the piriformis. Oh, so this inferior gluteal nerve is going to supply the gluteus maximus here, and this is superior gluteal nerve, which is above the piriformis, will give nerve supply to the gluteus medius and minimus muscle. Hey, because it is above the piriformis, it is closer to the gluteus medius and minimus. Below the piriformis, it is closer to the gluteus maximus. So the anatomy gets a little bit deeper and deeper in your mind. Now you can imagine a buttock which is covered with the gluteus maximus, and if you lift up the gluteus maximus, you now appreciate what is underneath. Okay, so the pelvic again, looking from the front, the ilium, superior pubic rami, inferior pubic rami. This is the ischial tuberosity. This is lesser trochanter, and this is the greater trochanter of the femur. This is the femoral neck here, femoral neck, and this is the rounded structure, femoral head, and anterior superior iliac spine and anterior inferior iliac spine. As I always say, anterior superior iliac spine is so easy to feel on yourself, and I want you to feel it. And because if we know that anatomy, we know the radiology anatomy as well. This is the femoral neck, and this is the femoral head, and this is the greater trochanter. Lesser trochanter is a little bit difficult to see on the plain radiograph. Superior pubic rami, inferior pubic rami, and there must be ischial tuberosity. Anterior superior iliac spines are here, which we can easily see and feel. Anterior inferior iliac spine might be somewhere here, which is more difficult to feel or see. Okay. Now we fill up that area with the muscles. And where do we start? We start with the quadratus lumborum, which is running from the 12th rib. Look at that. It is coming from the 12th rib. Quadratus, it is like another quadrangular muscle, come and attach to the iliac crest. Yeah, iliac crest. And the iliopsoas muscle, which is originating from the tip of the transverse processes of the lumbar 1 to 5, usually, but it might originate from the 12th thoracic vertebra as well. And this psoas, which is psoas major and psoas minor, doesn't really matter. Psoas major and psoas minor will come together with the iliacus muscle, which is the covering of the inside the ilium, which is here, iliacus muscle. And combined iliopsoas muscle will go and attach to the lesser trochanter. So this lesser trochanter, so iliacus muscle and psoas muscle will form a tendon and will come and attach to the lesser trochanter. And from the tip of the anterior superior iliac spine, we have a sartorius muscle. Look at the sartorius muscle running oblique from lateral to medial, just in front of the thigh. And that split the anterior muscle into two groups, medial adductor group and more anterior and lateral quadriceps femoris group. So let's go and look at this muscle here. This is the sartorius muscle, which split the anterior aspect of the thigh into more anterior and lateral group of muscles and more medial group, which are filled with the adductors, adductor longus, adductor magnus, and this is most medial muscle is called gracilis. And this adductor combined adductor tendon, which is in the pubic bone, which is going to the pubic bone, which can be easily seen, or you can easily feel on yourself in your groin. This adductor tendon, which is easily felt, and there is a muscle above the adductor muscle group, which is called pectineus muscle. Pectineus. Okay, so adductor, which we close the legs together, which we not spread the leg, which we close the legs together because it is adduction. It consists of adductor longus, adductor magnus, and adductor brevis, which is underneath the pectineus. We need to get open, lift up the pectineus to see the adductor brevis. And we were talking about the anterior and lateral group of muscle, which is what we call quadriceps femoris. Quadri means four. So combination of four muscle, it is called quadriceps because it is in the femur, so quadriceps femoris. It is made of rectus muscle. Here, look at the rectus muscle, which is a big muscle. It is very straight. The name rectus means straight. We have seen the rectus abdominis. We have seen the rectus rectum. We have seen the rectum already, and we are seeing the rectus femoris as well. Rectus femoris together with the vastus lateralis, vastus medialis. So lateralis on the lateral side, medialis on the medial side, and vastus intermedius here. So vastus lateralis, vastus medialis, vastus intermedius together with the overlying rectus femoris. That is what we call quadriceps, forehead. So this quadriceps muscle occupies the anterior and lateral portion of the thigh. Okay, and this quadriceps, all the muscles fuse together to form the quadriceps tendon of the femur, tendon of the quadriceps femoris, and that way come and attach to the patella. Oh, yeah, it's good. So this is the cadaveric, which is similar to this diagram, and now we are going to the cadaveric. And in the cadaveric, just start with the sartorius because it is a slim muscle. It is a very long muscle. It is oblique, running from lateral anterior superior iliac spine, running to the medial anterior, running to the medial aspect of the knee, and it will come and attach to the medial aspect just below the knee. That is sartorius. So medial aspect of the sartorius is adductor group. Lateral and aspect of the sartorius is anterior and lateral aspect, which is the quadriceps femoris group. Okay, finally, this quadriceps will come and attach to the patellar tendon, and we continue as the patella, and patella will continue as the patellar ligament. What is the ligament between a tendon and the ligament? They are all connective tissue, A tendon is a very tight connective tissue. Ligament is also a group of connective tissue. They are structurally very different, but the only difference is a tendon, patellar tendon will run from the muscle to the bone. A ligament, we have to run from bone to bone. So that is the difference between the name change between tendon and ligament, but structurally they are near identical, or well, let's say identical. But the tendon, we have to run from the muscle to the bone. And if you want to say it is a ligament, it should be running from the bone, which is the patellar bone, to the tibia tuberosity. Therefore, we have to call patellar ligament. Long ago, we call patellar tendon. So there will be a few people who are still calling patellar tendon. So theoretically, they are not 100% correct. So this is the quadriceps tendon. This is the patellar tendon, which keeps the patella in the more neutral position. So the quadriceps tendon is pulling the patella upwards. Patellar tendon is pulling the patella downwards. So one is pulling upwards, one is pulling downwards, then that creates the equilibrium for the patella to stay in its position. So let's say if we have a ruptured or damaged patellar ligament, the quadriceps tendon will pull the patella upwards. If we have a ruptured quadriceps tendon, the patellar tendon will pull the patella downwards. So that is the the balance for the patella, whether it is going to run upwards or going to run downwards. Because it is quite common, especially when people get to like 40, 50, if they damage the knee, they can damage the patellar tendon or the quadriceps tendon. So that's we need to be careful with. Okay, another site for intramuscular injection on the lateral aspect. We have the vastus lateralis superficial and vastus intermedius deeper. So it is really safe. So if you need to do intramuscular injection in somebody, the safe place is lateral aspect of the thigh. There is nothing. You just stay in the midline of the lateral aspect of the thigh, just inject it. So you are not going to damage anything. So because we will have the vastus lateralis and vastus intermedius here, which is covering the femur. And don't forget this Marcidi side. And as we all understand, everything in life for anatomy is 3. Yeah, 3. So external intercostal, internal intercostal, innermost intercostal. Intercostal muscles, how many layers? 3. Abdominal muscles, how many layers? 3. External oblique, internal oblique, and transversus abdominis. How many layers do we have in artery or vein? 3. Tunica intima, media, adventitia. The exception is our gastrointestinal tract, which is 4. And now, like in the femur, we have 3 compartments as well. So this is, let's say, this is the cross section of the femur. We divide it into 3 compartments. We have talked about the adductor compartment, which is made of adductor longus, adductor magnus, and adductor brevis. We have talked about the anterior and lateral compartment, which is made of the quadriceps muscle, and we will have the posterior compartment. So let's try to twist around with this Marcidi sign. And that is what we have here. This is the cross section. We are looking from the top. This is more distal, and this is the lateral, anterior, and medial. This anterior and lateral, this is the medial, and this is the posterior compartment. And this is the femur itself. So anterior and lateral compartment the muscles are filled with the quadriceps. Medial compartment, they are filled with the adductor longus, adductor magnus, and adductor brevis and gracilis. Posterior muscle, posterior muscle of the thigh, they are called hamstring muscle. So let's go and look at this. So medial compartment is adductor longus, adductor magnus, and adductor brevis and gracilis here. Anterior and lateral is quadriceps femoris, and posterior muscle is the group of called hamstring muscle, H-A-M-S-T-R-I-N-G. I believe if you do exercises, if you do gyms regularly, then you will see, these, or if you have met the physical therapists, they talk a lot about hamstring tightness. So this is the hamstring muscle. Hamstring is the group of muscle which is semi-membranous. It is more membrane-like. Semi-tendinous, which is more like tendon-like, and biceps femoris. We have seen bicep in our arm, which is what we call bicep brachii. Because it is in the femur, we will call it bicep femoris. So anterolateral group, rectus, vastus, lateralis, medialis, and intermedius. Medial compartment, adductor longus, adductor magnus, and adductor brevis, plus the gracilis. Don't forget grace. Posterior compartment, which is also called hamstring, they are made of semi-membranosus, semi-tendinosus, and biceps muscle. So this is the three group of muscle in our thigh. Three group of muscles in our thigh: adductor group, quadricep group, and the posterior group, hamstring group, which is made of semi-membranosus, semi-tendinosus, and bicep muscle. Let's move on. Let's look at the surface anatomy. So now we can appreciate these muscles. Sartorius, coming from the anterior superior iliac spine, which is from the pelvis, crossing the thigh obliquely, and it will come here down. It will go and attach to somewhere around here. Okay, and this divides into medial adductor group and anterior and lateral, the quadriceps group. Quadriceps made of rectus, vastus medialis, and vastus lateralis, and vastus intermedius underneath the rectus femoris. And this is the adductor group, adductor longus, we can see. And there we now created a little triangle, which is bounded by the sartorius, by the adductor longus, and the inguinal ligament. This is what we call femoral triangle. The triangle in the groin, femoral triangle. Okay, you have seen this diagram again and again now already. Lateral and anterior anterolateral compartment muscles. This is the cross section. We are looking from the top. This is the femur. Look at the vastus lateralis. Look at the vastus lateralis. It is huge and big, vastus lateralis. Look at the vastus intermedius. It is just immediately covering the femur, more deeper to the rectus femoris. And this is the vastus medialis. Adductor group, and this is the hamstring group. Okay, so that's what we saw and what we see. So now I hope you will be able to answer this question, this diagram. What is this muscle? What is this muscle? Or what is this muscle? Or what is this muscle? So they are all easy, and I don't think it is difficult to remember. Origin and insertion, have a little look, not very important, but the more you understand, I think you will have more interest in looking into the origin and insertion of the muscle. But, to start with, just try to know the muscle, which is what, and gradually that way expand your knowledge into origin and insertion. So back muscle, posterior aspect of the thigh. The muscles are hamstring group of muscle, which is made of bicep femoris, semitendinosus, and semimembranosus. Look at here, bicep femoris, from here coming to the outwards lateral aspect of the knee, and semimembranosus and semitendinosus from the buttock region here coming to the medial aspect of the knee. Hey, where do they originate? The hamstring group of muscle, semi-T, semi-M, and the bicep. They originate from the ischial tuberosity. So let's say if you are sitting now, then you are sitting on your ischial tuberosity, which is the here bony band. That's the superior pubic rami. This is the inferior pubic rami. This is the pubic symphysis, and this is the ischial tuberosity. So you are, if you are sitting on ischial tuberosity, and the origins of the semi-T, semi-M, and bicep femoris, they originate from the ischial tuberosity. It is just here. So these muscles originate from the ischial tuberosity and run down. Bicep will run to the lateral aspect of the knee, and semi-T and semi-M will run to the medial aspect of the knee. And you can see the gracilis muscle. So this hamstring is dividing into left bicep and lateral bicep and medial semitendinosus and semimembranosus. So that is going to create a diamond-shaped structure here. So now this is the adductor longus, adductor magnus, and adductor brevis. Hey, this is here. Adductor brevis is, we have to lift up the pectineus muscle to see the adductor brevis muscle here. Yeah, so the adductor brevis muscle, brevis means short, which is really small muscle, which is hidden by the pectineus muscle. Adductor longus, adductor magnus, and adductor brevis. And here you can see the adductor magnus muscle, which is splitting into two sheets. It is attaching to the femur, and it is attaching to the medial aspect of the femoral condyle. And now by doing so, they make a little hole here. So that is what we call adductor hiatus. So let's concentrate on the back. The posterior aspect of the thigh muscle, we know that hamstring muscle, they are made of biceps and semi-T and semi-M. And we know that bicep muscle will go to they all originate from the ischial tuberosity, but bicep muscle will go to the lateral aspect of the knee, and semi-T and semi-M will go to the medial aspect of the knee. And now you can see the calf muscle, which is made of the gastrocnemius. So this is the medial head of the gastrocnemius, and this is the lateral head of the gastrocnemius. So now we are creating a diamond-shaped structure. One is bounded by the bicep laterally, and one side is bounded by the semitendinosus and semimembranosus laterally. And in the lower part, it is bounded by the lateral head of the gastrocnemius, and on the medial side, medial head of the gastrocnemius. And now there is an imaginary, like a diamond-shaped structure area, which is what we call popliteal fossa. Popliteal fossa, you need to know popliteal fossa, and you need to know the boundaries of the popliteal fossa. So boundaries of the popliteal fossa: biceps, semi-T, semi-M, medial head of the gastrocnemius, and lateral head of the gastrocnemius. It is pretty simple, but you have to just, you have to keep an eye on where it is going. And this gastrocnemius, together with the soleus, they finally merge together to become the calcaneal tendon. Calcaneal tendon. And this calcaneal tendon, we're going to attach to our calcaneus. Hey, that is the calcaneus, the calcaneal tendon can attach to the calcaneus, medial head of the gastrocnemius, lateral head of the gastrocnemius, and soleus. So gastrosoleus complex, we join and together become calcaneus tendon, which is what we call Achilles tendon, tendoachilles, TA, Achilles tendon or calcaneal tendon. It is this tendon behind our posterior aspect of our ankle, which is really, really, really important tendon. So if we look on the front aspect of the knee, that is what we are going to see. Hey, what is this muscle? This must be vastus lateralis. What is this muscle? This must be vastus medialis. And this is the knee, and this must be the patella, which is the kneecap, and the quadricep tendon can attach to the patella. And from patella, the tendon ran to the tibia tuberosity, and this is what we call patella ligament, because it is running between patella bone and the tibia tuberosity, can attach to the tibia tuberosity. And now we can see our tibia. We can see our tibia bone, which is the shin bone here now, and fibula will be somewhere around here. Right, I hope you are following with me. I know there are a lot of names to remember, but you know, it's just like, you know, keep going again and again, again and again. That's the anatomy, because you are going to base this knowledge, and then you are going to learn more, you know, higher knowledge based on this anatomy. So you have to remember these little things. Yeah, to some extent, you know, it is more like might be that just pick up and have a photographic memory and then repeat it. And then only then, you know, if you see, it is just like picking up the face and the name together. So that sort of stuff. So let's move on. Another Marcidi signs for the leg. Hey, so how many groups of muscles in our leg? 3. So it is not a big surprise. How many group of muscles in our thigh? We have 3. How many groups of muscles in our leg? We have 3. So yeah, so it is again like, you know, pretty similar, but slightly different. So this is the cross section of the right leg. So right below the knee. And this is the medial side. This is the lateral side. So I want you to feel your own tibia and tap on your tibia. And we are doing the cross-section image across the tibia. And this is the tibia bone. And this is our shin. This is the bone we will be able to feel easily. And this is the shin bone. Yeah. And this is the medial surface of the tibia. And now we are dividing into 3 compartments on cross section. We have the anterior compartment, we have the posterior compartment, and we have the peroneal compartment. Hey, I have drawn a little bone here. This is what we call fibula. Fibula is inside the peroneal compartment. And the marsa septums running from the tibia will go to the skin. The marsa septum will from here to the tibia, will go to the fibula and then go to the skin. So by doing so, these septum split the leg into 3 compartments: anterior compartment, posterior compartment, and peroneal or lateral compartment. Lateral compartment, anterior compartment, peroneal compartment. Okay, this is the cross section. This is the lateral aspect here. This is the medial aspect here. This is the anterior, and this is the posterior. So you are making a cross section and you are looking from the bottom upwards. This is the right side. This is the right leg, and this is the lateral, this is the medial, this is anterior, and this is posterior. And you can see the tibia, and this is the edge of the tibia, anterior surface of the tibia, which you can easily feel, which is just subcutaneous bone, which is just underneath the skin. Yeah, I hope you have the orientation. And you can see the anterior compartment, which is colored with blue. You can see the lateral or peroneal compartment, which is colored with green. And you can see the posterior compartment, which is colored with red and yellow. Oh, so which means the posterior compartment can be divided into superficial group muscle and deeper group muscle. So I appreciate that the anatomy, especially the cross-sectional anatomy of the leg is very complicated if we do not understand. So just sit down and we think about 30 seconds. We sit down and think about 30 seconds. Just check whether we understand this diagram or not. And I am going to explain you about this diagram. So, okay, about 30 seconds, let's try to have a look. And this is the anterior aspect of the leg. This is the cross section. And this is the anterior aspect of the leg. This is the posterior aspect of the leg. This is the lateral aspect, and this is the medial aspect. So just try to hold your leg and then start thinking about it. This is lateral, this is medial, this is anterior. And now you can feel the tibia, your shin bone, which is called tibia. This is the sharp edge of the shin, and this is the medial surface of the tibia, which is just under the skin. You can see this surface, tibia surface, and you can feel the edge, sharp point, and you can feel along the leg of your tibia. And this is a little fibula, which is more on the lateral side. And now we are going to divide into 3 groups, which is the anterior group, and lateral or peroneal group, and the posterior group. Posterior group can be divided into more superficial group and deep group. Yeah, deep group is colored with yellow, superficial group is colored with red. What muscles are we going to see in the superficial group? Of course, those 2 big muscles which we saw, gastrocnemius, medial head, gastrocnemius, lateral head, and the soleus. Of course, we are going to see the gastrocnemius medial. Look at that, gastrocnemius, and gastrocnemius muscle. And look at the soleus. Soleus is very big muscle here. So if you squeeze your calf muscles, just squeeze your calf muscle, and you are squeezing the gastrocnemius medial, gastrocnemius lateral, and the soleus muscle. Hey, soleus muscle is really, really big, guys. Big soleus muscle and big gastrocnemius muscle. That is what you can feel. So if you squeeze this, underneath what you are squeezing, we have the deep groove of the posterior muscles of the leg. Let's go and explore a little bit more. So origin and insertion, as I say, it is a little bit complex, and I just want you to forget about that. Only when you know the muscle, just go and have a look, origin and insertion. So I have talked a lot of muscles in our leg, and I divide it into 3 groups. So the muscles for the anterior group, this muscle, this group, or yes, this group muscle, the color with blue, anterior group muscles. How can I remember this anterior group of muscle? So these anterior group of muscle, they are crossing in front of our ankle as a tendons. So like, you know, like the same thing in our forearm. How can we remember the muscles in our forearm in the dorsum aspect? We study the tendons on the extensor aspect of the wrist, and we relate these tendons because they are originating from the muscles of the extensor aspect of our forearm. So the same thing, like anterior aspect of the muscles, there are too many and we cannot remember. So we are going to remember the tendons which are crossing in front of the ankle. So because these muscles will become tendon and they cross the muscle, they cross the ankle from the anterior aspect. So hey, what are the muscles of the anterior compartment of the leg? So these muscles are crossing the ankle in front of the ankle as a tendon, and we will remember that as Tom, Dick, and very not. Tom has a very dirty, nasty pee. So hey, look at that anterior group muscle. That they become tendon and crossing the ankle from the in front of the ankle, from medial to lateral. So from medial malleolus to the going to the lateral malleolus. So it is in order. Yeah, it is in order. We will try to remember the muscle as Tom has a very dirty, nasty pee. So now, what is Tom? Tom is tibialis anterior. What is Hess? Hess is extensor hallucis longus. What is A? A is for artery. What is very? Very stand for vein. Dirty. Dirty stand for D, digitorium, extensor digitorium. Nasty, N for nerve. And P stand for peroneus tarsus. So if you look at the muscles in front, in anterior compartment of the leg, so from medial malleolus to Tom, look at Tom, tibialis anterior, that is what you are going to see here, tibialis anterior. Has extensor hallucis longus. A is stand for the anterior tibial artery, will be here, which come out as a dorsalis pedis artery. A very, so artery will be followed by the vein. A very dirty is digitorium, extensor digitorium longus. Look at the dirty here. Dirty is going to the small digits, extensor digitorium. A very dirty, nasty. Nasty is for the nerve. So the nerve will be here. You can see the nerve running here. A P stand for peroneus tarsus. So anterior compartment muscle, of course, you know, not just the muscle, it is the order of arrangement of the muscles and tendons in front of our ankle. Tom has a very dirty, nasty P. P, don't think too far, it is peroneus tarsus, yeah? Right, so I hope you remember Tom has a very dirty, nasty P. And this is the order. Tom tibialis anterior, has extensor hallucis longus. A stands for the artery, very V artery and the vein. Dirty is the extensor digitorium, and P peroneus tarsus, which is a small tendon, which we see later. So if I show you this diagram, this is the left leg anterior compartment and the ankle and the tendons of the anterior compartment crossing the ankle in front and going into the foot. And this is the same. This is the right side anterior compartment muscle Tom, tibialis anterior is here. Look at this tendon, it is running to the big toe, so it must be the deep extensor hallucis longus, and this tendon, a group of tendon going to the multiple digits. So this is the extensor hallucis, extensor digitorum, and very dirty, nasty peroneus tarsus, which we cannot see here. Right, so I am going to stop here and just wonder if anyone has got any problem so far. Okay, very good. I hope you have picked up a few little things. And the muscles of the anterior compartment, we will try to remember as the tendons in front of the ankle. And this is the mnemonic. Tom has a very dirty, nasty P. And don't forget, we divide the leg into 3 compartments, which are anterior compartment, lateral or peroneal compartment, and the posterior compartment. Posterior compartment has got superficial groove and deep groove. Superficial groove, which is gastrocnemius and soleus, to gastrocnemius medial head, gastrocnemius lateral head, and the soleus big muscle here. And deeper groove, which we will have to study a little bit. As we study, like Tom has a very dirty, nasty P, and we will have the similar mnemonic for the posterior compartment deep groove. So posterior compartment muscle has superficial groove and deep groove. Superficial groove, you have seen gastrocnemius, soleus, and plantaris. So, hey, plantaris is a small muscle. So therefore, it is very difficult to see. Just hold on a second and just try to remember as plantaris. Have you seen plantaris? No, you haven't seen. Have you seen gastrocnemius? Yes, you have. Have you seen soleus? Yes, you have. Can you see soleus from outside? No, because soleus is covered with the gastrocnemius, medial head, and lateral head in our calf. Plantaris is very small and very deep, which we haven't seen yet. But what about the deep group of muscle? Again, deep group of muscles, there are quite a few, and therefore we will try to remember with the mnemonic, which is running on the medial aspect of the ankle. So let's say if you are sitting down, I want you to feel your own medial malleolus. So I believe you remember, medial malleolus is on the medial aspect of the ankle, which is the big bony bump. Lateral malleolus is on the lateral aspect of the ankle, which is the bony bump, which is coming from the fibula. Medial malleolus is coming from the tibia. So if you run from the medial malleolus posteriorly, from the mediolus to the Achilles tendon, from the mediolus to medial malleolus to the back posteriorly. So this is the order from the medial malleolus to the Achilles tendon. Tom, Dick, and very naughty Harry. Tom, Dick, and very naughty Harry. Tom is tibialis posterior. We have seen the tibialis anterior. Dick is the flexor digitorum. And is for posterior tibial artery, very posterior tibial vein, naughty posterior tibial nerve, so neurovascular bundle here. And hairy is for flexor hallucis longus, just pulling the big toe downwards. Tom, Dick, and very naughty Harry. So Tom, Dick, and Harry, that's what you need to remember for the deep posterior group of muscles here. This deep posterior group, yellow, which is made of Tom, tibial is posterior, dick, flexor digitorum longus, and hairy, flexor hallucis longus, which are all colored with yellow. Right. So this is the posterior group of muscle, and as I say, the posterior superficial group is made of gastrocnemius, soleus, and plantaris. Posterior deep group, Tom, Dick, and very naughty Harry. Tom, Dick, and Harry, which is here. Popliteus is the deep group. Okay. And looking, hey, okay, just before you leave, let me speak about the lateral aspect or lateral group or the peroneal group. Peroneal group has only two muscles. They are peroneus longus and peroneus brevis. You can see the peroneus brevis, longus and brevis tendon here, up here, and they become the tendon here. They run just posterior to the lateral malleolus. So now I want you to feel your own lateral malleolus, and just posterior to the lateral malleolus, we have the peroneus brevis. Brevis means short, but B for B. Peroneus brevis is closer to the bone, lateral malleolus, and peroneus longus is a long tendon which is running here just posterior to the peroneus brevis. So this anterior tendon is peroneus brevis. This posterior tendon is peroneus longus and brevis in the peroneal compartment, which is on the posterior and lateral aspect of the ankle and the leg. Hey, this is the little plantaris tendon running here above the knee and down to the crossing the ankle here. So it is a very small muscle. Let's try not to dig into this muscle. Yeah, we just remember as the plantaris muscle. So yes, looking at the left ankle from the back posterior aspect, this is the lateral malleolus, this is the medial malleolus, and on the medial malleolus side, we have the two tendons, which is peroneus longus and peroneus brevis. On just posterior to the medial malleolus, we have the Tom, Dick, and Harry. This is the left ankle, this is the medial aspect, this is the lateral aspect. So we have the peroneus longus and brevis tendon here. On this side, we have the Tom, Dick, and Harry. Okay, so muscles of the lateral compartment of the leg, peroneus longus and peroneus brevis. All right, guys, so it is nearly 11 o'clock. So let's take a break and we'll get away from all these muscles in the leg. We'll get away from all the muscles in the leg and we have 15 minutes break. And after that, we will continue and we finish each. So muscles of the lateral compartment, we only have two muscles, which are peroneus longus and peroneus brevis. Brevis is closer to the bone, B for B, and closer to the fibula. Yeah. So peroneus longus is a long tendon. So if you look at this diagram again, this is the Achilles tendon or calcaneal tendon because it go and insert to the calcaneus, which is made of gastrocnemius and soleus, gastrocnemius and soleus complex. And these two tendons, lateral malleolus, this is the little toe. So this is the lateral aspect. This must be the lateral malleolus. These two tendons, peroneus longus and peroneus brevis. Brevis and longus because long tendon. Okay, and so we are dividing the right leg. This is anterior. Look at that. This is anterior. This is posterior. This is the lateral, and this is the medial aspect. We can see our tibia, which is just underneath the skin, and surface of the tibia is on the anterior and medial aspect. And this is the shin, like sharp edge of the tibia, which we can see sharp. And this divide into anterior compartment, lateral or peroneal compartment, and the posterior compartment. Yeah, posterior compartment muscles divided into superficial groove and deep groove. Anterior compartment muscle, the way we try to remember is Tom has a very dirty, nasty pee. That is the order of the tendons which is crossing the ankle in front from medial to lateral. Tom has a very dirty, nasty pee. And the peroneal compartment muscle, there are only two, peroneus longus and peroneus brevis. Posterior group can be divided into superficial and deep. Superficial group is gastrocnemius, everyone knows gastrocnemius, and soleus. And deep group is the plantaris muscle in the deep group, and the Tom, Dick, and Harry. Tom, Dick, and Harry in the deep group. So that is the picture of our leg in cross section. Don't forget lateral, medial, anterior, and posterior, 3 groups. And Tom has a very dirty, nasty pee, and Tom, Dick, and very naughty Harry in the posterior deep group. Gastrocnemius and soleus in the superficial group. Right. Okay, so now looking in the back, you can see this is the right leg, this is lateral side, this is medial side, and this is the posterior view of the right leg. So lower part of the femur, upper part of the tibia, and the knee joint posterior aspect. So I hope you have the orientation. This is the posterior view of the right knee. This is the lower thigh. This is the upper leg. And this is the back of the knee. And you can see the bicep femoris coming from the ischial tuberosity, and going laterally. And the semi-tendinosus and semi-membranosus. Let's try to remember as semi-membranosus. M is on the medial and T is more on the lateral aspect, but they are both running to the medial aspect of the knee. So this hamstring, semi-T, semi-M, and bicep, they split and they create a little upper triangle, and gastrocnemius lateral head, gastrocnemius medial head, they create another lower V shape. And by combining this, we see the diamond shaped structure, which is what we call the popliteal fossa. Yeah, gastrocnemius lateral head, gastrocnemius medial head, bicep anterior and lateral, semitendinosus and semitendinosus on the medial, which create a diamond structure, which is what we call popliteal fossa. Yeah, popliteal fossa. So inside the popliteal fossa, we have a tibial nerve. Hey, look at the tibial nerve. Tibial nerve is the division from the sciatic nerve. Sciatic nerve we divide into common peroneal nerve and tibial nerve. This is the tibial nerve. So this anatomy is really important, which is just in the back of your knee and in my knee. And therefore, it is such an important. So anyone injury to the back of the knee or the significant injury to the knee joint, this anatomy is really, really, really important because they can damage the tibial nerve, they can damage the common peroneal nerve. Look at the common peroneal nerve and the tibial artery. Look at that. Look at that. Semitendinosus, semimembranosus, bicep, gastrocnemius lateral head, gastrocnemius medial head. Yeah, so this is the popliteal fossa. Popliteal fossa anatomy is important. The higher you go up, the more you will have to appreciate this popliteal fossa. Now I'm just going to get the gastrocnemius head off, and I can see the soleus muscle. And this is like getting deeper and deeper. And now we are seeing the common peroneal nerve, this tibial nerve, and that's like big nerve and the deeper structure in the back of the knee. Hey, look at that. Peroneal. I was just keep saying peroneal, peroneal. In other words, peroneal is equal to fibularis. So common peroneal means common fibularis. And peroneus longus, peroneus brevis here. Fibularis longus, fibularis brevis. So our textbooks will give the name fibularis, and I just keep saying peroneus, but they are the same. This is the medial malleolus. This is the lateral malleolus. Posterior to the medial malleolus, we will have Tom, Dick, and Harry. Yeah, posterior aspect of the medial malleolus, we will have the Tom, Dick, and very naughty Harry. So the posterior aspect of the lateral malleolus, we will have peroneus, longus, and brevis. You can see the Achilles tendon or calcaneal tendon in the back of our heel and behind the ankle. That is the Achilles tendon or the calcaneal tendon. So this is and you can feel the head of the fibula somewhere around here. So it is a little bit difficult to feel on our own. And this is the anterior view. You can see, you can easily feel the shin or the anterior border, anterior edge of the tibia. This is the medial surface of the tibia, which we can all feel. And the tendon crossing in front of our ankle is Tom, Dick. Tom has a very dirty, nasty pee from medial to lateral. Tom has a very dirty, nasty pee. And this is the lateral malleolus. So these are the muscles of the leg, which is to some extent, it is good to remember. So because this is the cross section of our thigh. This is the femur, because we can see the femur, anterolateral aspect, quadricep posterior, which is hamstring, and medial aspect, which is the adductors. Hey, let's look at this gastrocnemius, medial head, and the lateral head. This is the Achilles tendon, or in other words, it is also called calcaneal tendon. Okay, so now the muscles of the sole of the foot. So it is to some extent, for the undergraduate muscles of the sole of the foot, it is not important, I would say. But in reality, I just wonder, it would be nice to know the muscles on our sole of the foot, so that we appreciate our feet, and we know what is inside, what are the muscles inside our feet. So there are lots and lots of muscle in our feet, and we are not going to dig into details like the muscles in our back. The muscles in our back, what I want you to remember is, external, extrinsic, and intrinsic muscles of the back. So that's the way we try to remember muscles of the back. Extrinsic muscle, what are they for? They are coming from the back, and they are going to the thorax or the upper limb for the movement of the upper limb or for the respiration of the thorax. That's the posterior muscle, extrinsic muscle. Intrinsic muscles of the back, they are just movement of the spine and spine itself. So that's the way we try to remember muscles of the back. And the same thing for the muscles of the foot, muscles of the sole of the foot, which is also called plantar aspect of the foot, because we are working on these muscles. We are using these muscles every day. And I just wonder, it might be nice to know all the muscles like in a little group so that we appreciate. So every step we take, these muscles, we have to deal with the function. So I think it's good to remember the muscles of the sole of the foot, but for the sake of the exam, it is not important. Yeah. So if now I want you to look your own plantar surface or sole of your foot. Hey, what are these? Of course, our skin on the sole of the foot is really, really hard structure. Yeah, it doesn't want your shoe, the shoe you are wearing, like Nike or anything else, they will wear out at some point. But this sole of the foot, the skin over the sole of the foot or on the plantar surface of the foot, it is, of course, we are not using too rough, but they don't wear out. It will last with you for the rest of your life. So look after it, the sole of your foot, the plantar surface, the skin is really hard and thick, and it is really flexible. So yes, if we remove that, we will have the 4 layers. So first layer, second layer, third layer, and 4 layer. So if you remember 4 layers on the sole of the foot, if we can divide the muscles into 4 groups in the sole of the foot, I am happy with. Of course, we cannot be just content with small little things. So we will dig a little bit more. So the first layer is more superficial, and the 4th layer is the deepest muscle. And I want you to remember as the top layer or most superficial layer is short or small. So short, brevis, it is short, small, or digit minima, or just like little short muscles. Let's try to remember as short muscle. And second layer as long muscle. Short, long, and brevis again, and long muscle here. So short, long, short, long. Is that good enough? Well, yeah. Now we remember the muscles in our sole of the foot or plantar surface of the foot as 4 layers. 4 layers. And how do we remember short, long, short, long? So first layer is short muscle, second layer is long muscle, third layer is short muscle, and 4th layer is long muscle. Well, we are Bio 004, A0208 students. So we need to know a little bit more than other students. So now just try to call their names. So flexor digitorum longus. So flexor means it will flex the toe. Digitorum means small toe, not the big toe, not our holoxis. Holoxis will be flexed by the flexor hallucis. So 4 lateral toes, so 2nd to 5th toes, flexor digitorum brevis, it is a short muscle. And abductor hallucis. Abduct means going to the little toe side. Abductor digiti minimi, so going to the. So second layer is quadratus plantae. Look at another quadratus and lumbrical. If you cannot remember these names, it doesn't really matter. It is just like, just try to know them. And yes, they are not very friendly to remember, and we will forget them. And the third layer, again, like short, flexor hallucis brevis. Flexor means going to flex the big toe. Hallucis means big toe. Brevis means it's short muscle. So because the long flexor came from the Tom, Dick, and Harry. So now we got the Harry is the long flexor hallucis muscle, and this is the short flexor hallucis muscle. Adductor hallucis and flexor digiti minimi brevis. Fourth layer is plantar and dorsal interossei. So interossei is in the fourth and lumbricals is in the second layer. That's all. I hope you will forget it. That's fine. It's easy. As long as you remember 4 layers of muscle in our soul, I am happy with. So yeah, look at that. These are the muscles we were talking about. So now you can see the big muscle here. Look at that. It is going to the big toe. It's long to the down to the tip of the big toe. So this must be the flexor hallucis longus because it is going to the big toe hallucis. It is a big tendon and it is going to the tip. So it must be the longest tendon. So it is on the plantar surface. So it is the flexor of the toe. So this is the flexor hallucis longus tendon. That's, we might be right, we might be wrong, doesn't really matter. But at least something come out from our knowledge, and I'm happy with. So look at these little tendons going to the small toes. So they must be the digitorium, isn't it? It is if they are going to the tip of the toe, then it is longest. So flexor digitorium longus. Hey, look at the flexor hallucis longus, which is number 4. And flexor digitorium brevis. Look at that, number 6 here. Oh, look at. So yeah, it's very complex. I can't remember. I do not expect you to remember. But at least, I just wonder if you remember flexor hallucis longus. That might be nice. But at least I want you to remember as 4 layers of muscles in our sole or plantar aspect of the foot. Doesn't really matter at all, these here. That's the end of the lower limb muscles, guys. So I'm going to stop sharing this. And does anyone want anything, like any problem with these, the lower limb muscles? If not, I want to go to the renal for a little bit of revision in the renal. Yeah? Let's go there. Let's go to the stop sharing. And I'm going to share. Okay, I believe everyone can see this. So let's start. So this is the question bank. And I believe you remember inferior vena cava, that's abdominal aorta. Abdominal aorta has single anterior branches. They are celiac artery, superior mesenteric artery, and inferior mesenteric artery. There are paired branches, which is renal artery and the gonadal artery, which we cannot see here. Look at that. Right renal artery is running posterior to the inferior vena cava. Look at that. Hey, what is structure A? Can somebody answer for me? No? Yeah? Ureter, yes. What is structures B?
Abdominal aorta.
Brilliant. What is structure C? It is sitting on top of the kidney.
It's the adrenal gland.
Brilliant. Yeah. Adrenal gland or suprarenal gland, because sitting on top of the kidney, suprarenal gland or adrenal gland. Perfect. Okay, so that's one of the homework. And A, B, C, so you can answer this question. Hey, what is this?
Bowman's capsule.
Perfect. Bowman's capsule. So what is structure A? And what is structure B?
One of them is the afferent and one of them is the efferent
Really?
arterial.
Okay, I like it, Michelle. So you are going to tell me, because I can't remember which is efferent and which is efferent.
I can't remember.
So the way we try to remember is efferent is smaller and afferent coming in is bigger. Yeah. So because as we say, like the bigger artery came in, became the glomerular capillary, which is C, and leaving out is smaller. Efferent is smaller. So exit is small, entrance is big. So therefore, because big blood coming in and small amount going out, that will create the backward pressure in the glomerular capillary, which will be useful for the pressure for filtration. Yeah. So efferent leaving and exit is small, entrance coming in is big. So A is efferent, B is afferent arteriole. Okay, this is the Bowman's capsule. And the whole structure is called glomerular capsule, isn't it? Of the nephron, yeah, which is made of Bowman capsule and the renal corpuscle. Renal corpuscle made of the Bowman's capsule and glomerular capillaries. Perfect, perfect. I'm very pleased. Oh, the same structure. This is in the cadaver. So you are going to tell me which is what? What is structure A?
The vena cava.
Inferior vena cava, perfect. What is structure B? I hope you can see B going to this little one here.
B, is that the ureter? No.
No. What is D then? D is?
D is the ureter.
D is the ureter, because if you look at that, it is very vertical, very perpendicular, and if you follow it, if you trace it, it is going to the kidney. So it must be sitting on the tip of the transverse processor. So D is the ureter. What is
it the celiac artery or is it the superior mesentery?
Superior mesenteric is a end-pair branch, isn't it? Only one here. So this must be superior mesenteric. This must be inferior mesenteric, because there is no pair. It is only one structure coming just in front of the aorta. So this,
okay, so either the renal or the gonad.
Okay, so what is that? If it is a renal artery, it should go to the kidney.
Below the kidneys.
So yeah, below the kidney, so?
The gonad artery.
Gonad artery, look at that. Right gonadal artery and left gonadal artery here. Okay, so now you know the F is abdominal aorta, which divides into?
The iliac artery.
Yeah, common right common iliac and left common iliac artery. And it will give a branch called internal iliac going into the pelvis. give branch to the uterus, give branch to the urinary bladder, and it will continue as external iliac. And when it cross underneath the inguinal ligament, the name change femoral artery. Okay, perfect. And look at the ureter, the way it is going here. So this must be the urinary bladder. Where is the urinary bladder? Is at the very front. So I must be urinary bladder. Okay. Okay, let's move on. Where the identify structure E. Oh my God, I can't even remember what is structure E. What do you think structure E is? Helptheprofessor.com. Yeah, structure E. If you zoom into that, look at that.
The renal vein.
Yeah, renal veins. Yes. Look at the renal vein. Renal vein is running in front of the aorta, but renal artery is running behind the inferior vena cava. Look at that, renal vein. Hey, there is a little structure coming into the renal vein here, G. What does it look like? What does it look like? Does it look like ureter, or does it look like aorta, or?
It's like it's blue.
It is vein, isn't it? So I'm just going to back out. Okay, I'm just going to back out. Okay, I will just update this question. Yeah, look at that. Look at that. It is coming from downward here, going up here. Do we have similar structure on the right? Yes, we do here. But this blue, long, small vein is going directly into the inferior vena cava. But this long blue thread, pretty similar, these two. They're like brother and sister, pretty similar. But one is going directly into the inferior vena cava, and the other one is going into the renal vein.
So it's returning the lymph?
Okay.
Is it returning the lymph?
Yeah, returning veins from the gonads. Yeah. So testicular vein or ovarian vein. So right testicular vein will go directly into the inferior vena cava, and left testicular vein or ovarian vein, we have to go into the renal vein and then get into the venous system. So that is the little peculiar important point, you know. That's why in elderly patient, if they have varicose, like varicose means the blood vessels are piling like a varicose veins in our leg, you know, like the varicose vein in the testes, around the testes, in the scrotum. If we see a varicose in the elderly patient, we have to check the renal, and especially for renal vein, because renal cell cancer will trace along the renal vein and can block the testicular artery entrance. And therefore, the vein from the testes cannot go back into the renal vein and cannot. So there will be backward pressure, and there will be varicose like varicose vein around the testes in the scrotum. That's why if we see a varicose in older patient, especially older patient, we have to check the cancer for the kidney. Perfect. Let's move on to the next slide. Okay, we know that already. Structure D, we know that. Structure B, we know that. Hey, what do you call this? What do you call this? It is a nephron, isn't it? It is a nephron, afferent arteriole, capillary, efferent arteriole, and the Bowman's capsule, glomerular capsule, renal corpuscle, and the tube. So proximal convoluted tubule, distal convoluted tubule, loop of Henle. The same structure. That's the nephron, afferent arteriole, proximal convoluted tubule, descending limb, ascending limb, thin and thick ascending limb, distal convoluted tubule, collecting deck. Okay, and what is the question here? What is structure B? B is distal convoluted tubule. Yeah, distal convoluted tubule. A is the proximal convoluted tubule. That's the gestal glomerular complex. Which cells secrete renin? So this diagram, there is no label at all. There is no A, B, C, D. So which cell secretes renin? Of course, granular cell, isn't it? Granular cell. Macular cell will act as a chemoreceptor, and macular cell will ask the granular cell to secrete renin, and that will start the renin angiotensin aldosterone system. So let's have a look. Let's have a look. Which cells secrete renin? Granular cells. Oh, yeah. So the question is, which cells secrete renin? It is the granular cells. Of course, that's not a big deal for the students here. So A is renal cortex, B is renal medulla, C is renal pelvis, and D, renal columns, isn't it? Yeah. And C is renal pelvis. Okay. D, structure D. Let's have a look. Here, renal columns. D is renal column. Yeah. D is renal column. So identify the site where the renal corpuscle, proximal and distal convoluted tubules are. So these are the part of the nephron. Renal corpuscle means glomerular membrane or Bowman's glomerular capsule or Bowman's capsule plus the, what do you call that? The glomerular capillaries, combination renal corpuscle, which is part of the nephron, proximal and distal convoluted tubule. So where are they? They are inside the renal cortex. They are inside the renal cortex. So therefore, so the answer will be renal cortex, isn't it? Hey, here, normal urine. Normal urine contains more than 95% water. Yeah. So has highly acidic. No, it is not highly acidic. Like it is pH is about 5-ish. Has moderate protein. No, normal urine has very little or no protein at all. Normal urine usually contain small amount of what? Small amount of blood. No, normal urine usually contain no blood at all, or might be very small amount, which might be contamination. So normal urine does not have blood. Normal urine does not have protein. Normal urine is not highly acidic. It is like pH might be around 5. It's made of more than 95% water. Of course, urine. So what do you expect? Ah, what is that? This is the color CT following, showing polycystic kidneys. Look at that polycystic kidney. This patient has a lot of cysts in both right and left kidney. It is a congenital problem. It is a autosomal, like transfer from parents, autosomal gene. You are born with this patient is born with this. It is said, at early stage they will get into renal failure because the kidney has not much nephron left because they have a lot of cysts and fluid filled cysts here. That's very sad. The A is dotted with white. What is structure A? That must be renal pelvis. I make this question is just for entertainment, just want to show one of the diseases of the kidney, which is the polycystic kidney, which we can see with lots of little cysts, like multiple cysts inside the kidney. It's very sad. They will get early renal failure and they're going to die early. This is, again, like abdominal aorta, which is dividing into right common iliac and left common iliac. And look at the branch here. What is this branch? C. That is going into the pelvis. So that must be internal iliac artery. And the main branch continue from the common iliac is called external iliac artery. External iliac artery, once after passing underneath the inguinal ligament, it is called femoral artery. So D is external iliac and C is internal iliac artery because it is going into the pelvic. So it will supply the uterus and the bladder. And look at the aneurysm. I believe you know what an aneurysm is. Aneurysm is, the definition is abnormal dilatation of blood vessel. Look at that abdominal aortic aneurysm. It is big. And as we know, normal abdominal aorta might be about 25 millimeter or 2.5 centimeter. And this is much bigger. So abdominal aortic aneurysm, especially after 6 centimeter, it is something to think about the operation. Yeah. So look at it. It is said by, it is a very nice radiology image. It is the contrast study. And you can see the right renal artery, left renal artery. This is so above the renal, this must be the superior mesenteric artery. I'm not sure these are the testicular or gonadal arteries. One on the right and one on the left is a pair branch. So A and B. So what is A above? So let's have a look. What is A? I didn't ask. Hey, look at that. That is a little radio-opaque structure. This is the renal stone. So this is along the passage of the ureter because it is at the tip of the transverse process of the lumbar vertebra, lumbar 2, 3, 4, 5. At the tip, along the route of the ureter. Therefore, this is the ureter stone. So what is the question? Where is this stone at present? The stone is in the ureter. It is not in the kidney, it is not in the bladder, it is in the ureter. Let's have a look. So where is this stone? Yeah, the question is, where is this stone? Of course, it is in the ureter. It is not in the bladder. If it is in the bladder, it will be down here. It is not in the renal pelvis, and it is not inside the kidney. So yes, this stone is in the ureter. Why can you say it is in the ureter? Because it is along the tip of the transverse process. The route is at the tip of the transverse process, and therefore it is in the ureter. Right. Has anyone got any question?
I had a question not necessarily related to the material, but is there going to be a cumulative exam at the end of the course?
At the end of the semester?
Yeah.
Yes.
Okay. Thank you.
So the final exam, the end of the semester exam, it is very much the same like our monthly exams. So we will have like, might be about 50, 60 lecture questions and might be like 30, 40 lab questions, or might be 50, 50. So just around there. And the time scale is the same, or maybe I will give you a little bit longer so that you got time to think. But we will only have one chance because it is final.
Okay. Thank you.
All right, thank you. Okay, I will post the homework pretty soon for the lower limb muscles. All right, then I will let you go.
Bye. Thank you.
Bye-bye.
Thank you, Professor.
All right, Jackie.
Thank you.
Okay, bye-bye.